Hi everyone, welcome to the Body Care segment on the Health Monitor Show. I am your faithful host, Joan. On today's episode, we'll be talking about polycystic kidney disease. What is this disease? What are the signs? What are the symptoms? What are the solutions to this disease? We're going to know more about this, definitely not from me because I'm not a medical doctor. We have a medical doctor in the studio today, Dr. Isibo. I'm sure a lot of you are very familiar with him because he's graced our studio quite a number of times. He's going to be breaking this down so that we'll get a lot more understanding on what polycystic kidney disease is about. Do not go anywhere because this information will help you. Yes, you who's about to go somewhere or use your phone. Don't go anywhere. We're going to go on a quick short break, and when we come back, make sure you pay attention and, as usual, join the conversation. I'm going to be reading out a couple of questions that some of you have sent to us, and Dr. Isibo will do us the honor of giving us or shedding light to these questions. We'll be right back. This remains the Body Care segment. Hello everyone, we're back and this is still the Body Care segment on the Health Monitor Show. I remain your wonderful host, Joan, and in the studio, I mentioned earlier on that I'm not alone. I have Dr. Isibo with us today in the studio. Welcome, thank you so much. Your Health Monitor's favorite.
Thank you for having me.
Let's just get straight into it. This polycystic kidney disease sounds very scary. I feel like the diseases that have like very obonge names, for lack of better words, like strong names are usually like the scariest. Most people think that way. But in a layman's term, what is PKD?
Okay, PKD gotten from the word polycystic kidney disease. Just as it states, polycystic, poly means multiple. Then cystic means a fluid-filled cavity. Then kidney is a part of the body. So polycystic kidney disease refers to a medical condition that is characterized by multiple fluid-filled cavity in the kidney.
Okay, so poly is two. Multiple. Cystic
is fluid-filled cavity.
Filled cavity.
Yes, so let's say you have something like nylon with water inside. That's a cyst. But now you have like maybe a connective tissue or skin covering it. That's a cyst. Yes.
And we all know our kidneys.
Yes. So a medical condition characterized by multiple fluid-filled cavity in the kidney. That's polycystic kidney disease.
Let's just know, PKD, is this genetic? Can it be passed? But before we go there, are there multiple types? Because this question is going to go into the next question. Are there different types of PKD, or is it just PKD?
Okay, to start with, we have cystic disease of the kidney. We have the simple cyst that is not multiple. Maybe one cyst here, it can affect maybe just one kidney. But if it is polycystic kidney disease, it affects both kidneys. Now, polycystic kidney disease are genetic diseases. The simple cysts found in the kidney, not necessarily genetic. It can just be like an isolated, incidental finding that you find a cyst in the kidney. So for that one, cystic disease of the kidney can be genetic or not. But if it is polycystic kidney disease, it is definitely genetic. So if it is simple cyst, what we want to look at, the surface of the cyst. Let's say you are seeing just one cyst.
Yes.
Is it smooth? You want to know that. Are there debris inside? So if you see the surface is smooth and there are no debris inside, that is just a simple cyst. You leave it alone. Most likely nothing will come out of it. But if you see another cyst, just one cyst, the surface is rough, and you have debris inside, that can be a pointer that what you are looking at is a malignancy. So for that, you want to investigate.
When you say, what do you mean by
Malignancy, cancer.
Okay.
Yes. So for that, you want to investigate that, okay, let us put a needle, take some fluid out of the cyst and find out what is it we are dealing with. But for the polycystic kidney disease, there are two types and they are all genetic. So we have the autosomal recessive polycystic kidney disease that is found in children.
Okay.
Now, when we say something is autosomal recessive, it means that you need a pair of defective genes for it to cause a disease. So let's say one has just one defective gene.
Yes.
The person is fine. The person will not develop polycystic kidney disease. I'm talking about autosomal recessive polycystic kidney disease that is found in children.
Okay.
But for the autosomal dominant disease, if one of it is bad, the person will develop the disease. And when we say something is autosomal dominant, for you to recognize it, at every generation, somebody must have it. And it develops in adulthood, people in their 40s, thereabouts. So if I'm seeing it in somebody that is 40, I'm asking, between your father and your mother,
someone has to have it.
Which one of them has a kidney issue? And it usually starts in around the fourth decade of life, maybe somebody in their 30s, 40s, thereabouts, upward. That is when we usually see it. So maybe the person has a child already before the person is developing it. And so basically those are the two types, and it answers the other question. It is genetic.
Now, speaking about management, right, I was going to ask you, are there any risk factors that make PKD worse? And you've mentioned lack of time, like
yes,
if you detect it late. But outside time, are there like lifestyle choices?
Okay, with polycystic kidney disease, the person already knows that my kidney is at risk. That is not the kind of person that wants to be careless with his or her health. So, but with the question is, if there are other risk factors, let's say for instance now, one has polycystic kidney disease, and unfortunately the person also has something like sickle cell disease. These are both diseases that can equally affect the kidney. It's something that you need to put into consideration that, already I have a condition where my kidney kind of is fragile. I have to take extra care of my kidney compared to the regular population. I don't want to have HIV that will complicate it. I am pregnant. I don't want to go to traditional birth attendants that I will lose blood. At the end of the day, I will have acute kidney injury in addition to the chronic kidney disease that I have. Because when people lose blood rapidly, they can have acute kidney injury. But this is somebody already that has chronic kidney disease from the CKD. These are people that should be extra careful about their health, because especially health of the kidney, because they know they have one condition already that puts their kidney at a greater risk compared to the general population.
Okay, so let's go on a quick short break. When we come back, we're going to talk more on the symptoms and the progression of PKD. Do not go anywhere, guys. I told you that this episode is very important for you and those around you. So this is still the body care segment on the Health Monitor Show, where we're talking about polycystic kidney disease, also known as PKD. We'll be right back. Hi guys, this is still the body care segment on the Health Monitor Show, where we're still discussing PKD with Dr. Isibo. We've said quite a lot. You've dropped so many gems, but let's move because time is rather sensitive. If you've been listening very carefully, you've dropped a couple of signs and symptoms of PKD. Now, people want to know how quickly does PKD progress?
The rate of disease progression differs for different people. So let's say if I have somebody that has PKD, polycystic kidney disease, and the person lives well and everything, you know, and the person does not have other comorbid condition, other disease condition that can affect the kidney, of course the rate of progression will be slower.
Yes.
Even if eventually something would happen, but it will be slower because the person does not have other disease condition that can affect the kidney,
Yes.
and the person is living a healthy lifestyle. So the rate of disease progression is slower. But if I have somebody with, let's say, polycystic kidney disease that smokes, takes all kinds of drugs, lives very risky lifestyle, you know, having sex with multiple sexual partners without protection and things like that, I won't be surprised if, let's say, we discover it today that, oh, incidental finding, we just go and do, the person is not even showing any sign and symptom. It now progresses down to full-blown chronic kidney disease. You know, the lifestyle also has a role to play
Yes.
in the progression of the disease. You know, the care they have received. If one goes to the hospital or one is just buying over-the-counter medication, taking, because some of this medication can actually affect the kidney too. You know, so it might not even be that the person is wayward, you know, but the level of education each of them has received, you know, one is more enlightened to know that, okay, because of this I have to go to the hospital. The other one is not well enlightened. One has more money to go to the hospital, you know, and the other one does not have money to go to the hospital. You know, money and sarret all things.
I realized, Dr. Isibo, that people like to play doctor and they didn't go to school for it. So let's listen to the ones that actually went to school. Lifestyle is very important. So I want to just ask, can it be cured? Is it curable? Because I heard you say, you know, it can last 20 years, you know, until, is it a disease that for the rest of that person's life, they're going to have to manage and baby this disease? Or is it something that when you catch on time, you know, treatment, once you have treatment, there's a stop point?
Well, because it's a genetic disease, we cannot cure it. We cannot change your genes. That's follow come. So it's given to you by God. We are doctors, we are not God. We know our limitation. But we can actually help to manage that the person will live a reasonable life, manage every discomfort, and they are good to go. But it cannot be cured because it's a genetic disease.
Okay, so let's move on, because we know the organs that can be affected by PKD. So let's talk about the diagnosis and monitoring. You said that a test will be done to let a person know if they have PKD. Now, how often do my kidneys need to be monitored?
Well, that will be determined by the nephrologist,
okay,
which is the specialist that manages kidney diseases. And it depends on the stage we are seeing the person. Let's say if I see somebody with polycystic kidney disease and the person is not coming down with any complication, the person is fine, I'm just seeing multiple cysts, you can give a longer time and say, okay, come back in 1 month's time, come back in 3 months' time. It's not showing any complaint. Person is not hypertensive, no blood in the urine, no infection, no stone. You know, maybe I just discovered it. First, you want to educate the person that, okay, this is what you have. But it's a disease that over time it might progress. That is why we need monitoring. For now, it is okay. It's just an incidental finding. Come back in 1 month's time. Come back in 3 months' time. We just want to check and be sure.
Yeah.
If we find anything, we address it. But if I'm seeing somebody with polycystic kidney disease, already the person is having stone, the person is having infection, and that's not the kind of person you want to give 3 months appointments.
No.
Because the person is having other complications with it already.
Yeah.
So you want to address the problems you are seeing, give the person a shorter time, because you know that already for this person, the kidney function has deteriorated as compared to the previous person we discussed, that no complication, no stone, no infection, no other complication with it. So you want to give that person a shorter time. Okay, I'm seeing you now. We have addressed the primary issues that you have. Come back in 2 weeks' time. However, if before 2 weeks you have any complaint, you can always come back to the hospital. For some, you want to give a shorter appointment if they have something else you want to do outside what you are doing for them.
Okay, let's go on a quick short break. When we come back for the last lap of the body care segment on the Health Monitor Show, where Dr. Isibo has really taken time out to dissect and make us understand what PKD really is in its true nature. Don't go anywhere. It's still the body care segment on the Health Monitor Show. We'll be right back. Hi guys, we're still on the body care segment where we're discussing PKD, Polycystic Kidney Disease. A lot has been said about it, especially knowing now that it's a genetic disease. Surgery cannot be done about it unless you want to do a kidney transplant. You're just going to have to manage it. And depending on the severity of the PKD a person has, that will actually dictate how frequent you visit the hospital and how frequent you actually do tests. And Dr. Isibo made us understand that time is a factor that plays in any health condition, and lifestyle. Very, very important. So I'm sure you guys have heard, please don't self-medicate.
Everyone out there, please take good care of yourself. It is cheaper. Even if you have all the money, still take care of yourself, because there's nothing compared to the pain you will go through. How you feel when you are sick. You can have all the money.
Yeah.
We are able to keep you there. You are still alive, but are you feeling okay inside, deep within you? Are you feeling all right? So to anyone out there, somebody with polycystic kidney disease, you have a family member with polycystic kidney disease, you can join a support group. I'm always an advocate of support
groups.
Because a lot of people have gotten various wrong information. They have been misinformed. Get a support group, people that have had it in the past. How were they able to seek help?
Yes.
A problem shared somehow is a problem half solved.
Yeah.
Not solved, but half solved. Make sure you discuss with your doctor. It is cheaper that way. It is safer for you, and make sure you are getting the right information. Even if you check Google, please cross-check whatever it is you want to check on the internet pertaining to your health, because anybody can wake up and put an information on the internet.
Yes.
But if the real doctors that are treating you do not necessarily have the time to go to the internet, after work they want to rest, they want to sleep, and we are grateful for people like this that bring up program. You dedicate your time. Thank you to the video team, and God bless you.
Thank you so much, Dr. Isibo, for making time out to come here. And thank you so much, the lovely audience out there. You guys never fail to send your questions, curious questions. I'm happy that you don't look up to me to answer them, because I'm not going to give you the right answers, okay? I'm just going to sympathize and thank God. And thank you to all the doctors out there that take their time to go through medical school, come out and have a heart to treat human beings. Be part of the conversation by following, liking, sharing, and don't forget to turn on your notification button on YouTube so that when we upload new episodes of the body care segment on Health Monitor, you're up to date. Do not forget that the Health Monitor show is airing on this station at this time on this day. Until next time, have a wonderful life, and send your questions to the phone number on your screen now. Do not forget, guys, that health is wealth. Health Monitor Show, your guide to good health.